go ahead and turn them on to test them right now?
Works? Okay.
Yesterday?
Sure. I don't know.
I hope it is, because I like you. You're cool.
I like you too. This is good. We can talk. I can talk about anything.
Anybody fake and plastic?
No, no, I'm
She would do.
Yeah, here you go.
No, ladies.
Yeah. Absolutely.
And are we expecting?
Nice to meet you, Lauren. Oh my God. My daughter is in the finals of the soccer tournament.
That's why I was at soccer this morning, so I
Oh.
hear you.
And-
And how's she doing?
Well, they just finished scoreless, so it's now down to PKs, which is the worst.
That's the worst.
Way.
I know. That's the worst. way.
Worst.
How old is she?
She's
younger,
10.
right? Yeah, 10. Okay.
It's Team Botswana versus Team Norway. Seriously. Oh my gosh.
That's serious.
They're in PKs now.
So you have to kind of watch that. You have to watch
I
them
will.
for updates. I understand. You watch. You listen. It's important. Woohoo! If I see a little jump of joy. Ready. Bring it.
After lunch.
I know. It's just so
Yep. Okay. Hello, ladies and gentlemen. Before we get this final panel started, if you guys visited the My Style Matters table and you got a raffle ticket, pull those out because I am about to pull the winning number. Let's see. We have 177147. Nobody? Nobody? Okay, gonna go to the next one then. 177153. Oh, all right. And so she has it's a wellness package from My Style Matters. There you go. So without further ado, take it away, Katie.
Okay. So I'm very excited to get started with the last, but definitely not least session of our day. And we have a wonderful panel here to take some of your questions. And I want to do a quick introduction for them. In fact, I think I'll let them introduce themselves so that they can tell you a little bit more about their work. And then we'll just open it up for questions. Several people have turned in questions already, so we have those. But if you have a question for any of these amazing panelists, just raise your hand and we'll bring a microphone to you so that we can all hear. So we'll start with you, Lauren.
Hi, everyone. My name is Lauren Bober. I'm a physical therapist and the clinical manager at Turning Point Breast Cancer Rehab. Yay! Woohoo! I love that. That makes me feel so good. Warm and fuzzy up here. Thank you all. We are a specialized breast cancer rehab center. We have physical therapy, nutrition, massage, and counseling. We have exercise classes. We have a metastatic support group. And we have other educational classes during the month for all patients to enjoy. So I wanted to say thank you so much for having me here today. I'm excited to be on this panel.
Hi there, my name's Jake Salyerts, and I'm here representing Sacred Journey Hospice. So I understand hospice is a pretty delicate thing to talk about, and some people might have some questions about it. But I want you to know it focuses on keeping patients as comfortable as humanly possible with a team who is available to them 24 hours a day. So if you have questions about that, I look forward to answering them. Thank you very much.
Hi, I'm Stephanie Sparks. I'm the managing attorney of the Breast Cancer Legal Project at Atlanta Legal Aid. It is a specialized department of Atlanta Legal Aid that helps individuals who have been diagnosed with breast cancer, whether currently in treatment or in remission, and we assist with a variety of civil legal problems for free.
Hi, I'm Kimberly Christine. I'm the Director of Outpatient Palliative and Supportive Care for Emory Healthcare and School of Medicine. Our clinic helps support patients with advanced illness through their illness, managing the symptoms, and helping them with care coordination. So basically, we are the people who help you get your situation situated.
We'll get started with some of the questions that have already been turned in, but raise your hands at any time if you have a question for our panel. So here's question number 1. I'm newly diagnosed stage 4. I have triple negative breast cancer. My kids are 10 and 13, and I don't have a lot of support. My ex isn't involved. When should I start planning for arrangements for my children?
Today. You should start doing that now. And I say that for anyone, even if you are not stage 4, if you have any children, if you have a home, if you have anything valuable to you, you should have plans in place for a will, for an advance directive, and especially with children, for guardianship, for who will take care of those children if and when you pass away. I understand that these are difficult papers to prepare, even if someone who is 24 in the prime of their life would have a difficult time thinking about what would happen to them if they passed away. But they're so important, and they're taking care of yourself. They're taking care of your loved ones to prevent them from having to wonder if they've made the right decision that you would have made. And these are things that the Breast Cancer Legal Project can help you do for free. If you call us, and we had our, I'm happy to give you another business card, but we had a table outside. We can provide a will, an advance directive, guardianship papers, powers of attorney, anything and everything pretty much related to your estate planning is something that we can do for you.
I think the other part of preparation is actually figuring out a good way to speak with your children. And seeking a professional help to do that can be really important. Children's Hospital of Atlanta has several support groups. If you are in an institution that has palliative and supportive care, part of what they should be able to offer is tips and ways to speak with children, and there's lots online. But I find that to be the hardest, knowing when to say, what to say, and what's going to be age appropriate, and we do that quite a bit. Many of the palliative and supportive care groups will actually have counseling for children, and many of the hospices will have, some will have children life specialists. So there is support, and accessing it early, I think, is the most important thing.
So I think going along with the younger children, I think it's important, having children myself, we know how active and busy they are. And if you're currently having treatment, or if you are of concern about certain activities that you want to participate in with your child, I think it's important to reach out and make sure what's appropriate for you at that time. And so that you can be a part of their lives in the best way possible, and enjoy quality of life with not with what's going on in terms of your illness, but also in terms of spending time with your kids and enjoying all the things that 10-year-olds enjoy doing.
I know you're thinking of your questions. We have
There was a point where, not where I needed hospice or any of that, but when I was on a certain medication and I had major nausea. And one of the issues was trying to get CBD oil or something like that to help with the situation. My oncologist's office would not sign the state papers. There were 2 papers there so that you could get. My regular physician's office would not do it either. How do you get to a palliative care physician or someone in that position who usually does it? Because I know that somebody who has now passed away, that's how she got hers.
So I have some good news and some bad news about that. Most of our patients that we have are either Medicare or Medicaid patients, and Medicare and Medicaid do not recognize CBD oil as an efficacious treatment. I completely, wholeheartedly disagree with their judgment, because I have seen it do wonderful and outstanding things. Yes, ma'am. So as far as, we have a doctor that's available to all of our patients, an attending physician and nursing staff, social workers, chaplains, volunteers, all these things. Could I have a doctor sign a form to that effect for you? Absolutely. That form would bear no weight in us being able to financially provide that medication for you. However, what I would do is we would have a different discussion about, if you choose to get this medication, I want to talk to you about what I think are the most efficacious ways to get it and the ones that work the best, because a lot of things have the word CBD slapped on the side of them and they're not clinically effective. I had a patient about a year ago who 11 years prior to that was told, you have 3 months to live, get your affairs in order. And he had a wonderful 11 and a half years following that, because financially he was able to import laboratory quality CBD oil from Sweden. And it was outstanding for him. Well, that's a battle that we continue to fight with Medicare and Medicaid. I also would tell a hospice patient regarding this or any other matter, we only want you to be on hospice as long as we are your best option. The second we are not, you should drop us. Because here's the thing. You either qualify for hospice or you don't. We're not doing you a favor to get to take care of you. You're doing us a favor to let us take care of you. So the second we're no longer your best option, it's called revoking. You're not on hospice anymore. If you change your mind back in 10 days or 10 minutes, I send my admission nurse back out to readmit you. And as long as we're your best option, you keep us. That would be what I have to add. Ladies?
Thank you very much. So in our Emory Palliative Care Clinic, we do medical cannabis consultations, and we place patients on the registry as part of just the palliative and supportive care. So if you go online to georgiacannabis.org, there should be a list of providers that will register people for medical cannabis. Patients who are within the Emory healthcare system or get referred to our clinic, because we get a lot of THC oil consultations. We do a consultation for that, and if you meet the requirements by the Georgia law, and they have a few I think they're up to like 13 conditions. I always tell patients, remember, it wasn't based on science, it was based on who screamed the loudest. Of why the conditions are the way they are, but for very few people, we have to turn away. I think the important thing when you're thinking about medical cannabis, because Georgia's preparation is so narrow, is really having good expectations of what it can do and what it can't do. It also has drug interactions for people on anticoagulants, oral, if you're on diabetic medications, opiates and benzodiazepines, as well as anti-rejection medicine. So you want to sort of think about that in terms of a medicine. So if a patient has the option to see a physician, like me, I think WellStar's clinic is putting people on the registry. Kaiser, my good friend Kaiser, she's doing it. So if you can get to a palliative care clinic, Kaiser, WellStar, Emory, Veterans Hospital, they don't register, but if you can get to a clinic, then you requesting that there should be a provider within those clinics around that will be able to help. And I know that they're thinking, and I know there's opening up clinics in North Georgia, and down at St. Mary's. So we're all sort of together, and we're all kind of thinking about this in the same way. But I would really encourage you to get medical counsel before you use it. Number one, it'll go better, and number two, it might impact your health care. But yeah.
We'll go to another question that was submitted earlier. I'm so overwhelmed. I'm working full-time to keep my insurance, but I need to talk to someone about my options, how to talk to my employer, and when it's the right time to go on disability, and how.
Depending on where you're employed, you may be eligible for what's called FMLA, Family Medical Leave Act, which would give you 12 weeks of employment. Unfortunately, it would not be paid, which I know is not realistic for a lot of people. Again, depending on your employer, you may be eligible for short-term disability benefits, which is paid. It's usually paid at, I believe, 2/3 of the full income that you're getting. And that lasts for 12 weeks. There's also an option, depending on your employer, for long-term disability benefits. And then there's applying for Social Security Disability, SSI. You know, I'm throwing a lot of acronyms at you because it's just a very confusing and difficult process. That's true. There's no long and short of it. But the good news is that this is something that we see quite a bit, and we would be happy to help you sort of navigate that process of what your options are based on your specific employment, and try to help you figure out the situation that works best for you.
I would strongly encourage you to make that call. And if you go to a comprehensive cancer center, there should be a financial planner. So oftentimes you're only meeting them if your insurance won't cover the cost of the drugs. But the other things they know about is exactly this, as well as the social worker. Most of your palliative care and palliative and supportive care clinics will also have people to help you guide through this, because the timing has to be really good. Also, really understanding what the laws are in Georgia about work and about labor, and understanding your institution is really important in how they've handled these cases before. I've had some patients who've told their employers, and they've been wonderful, and they've let them work for home. They've made Herculean ways to make sure that they can continue to work so they don't have to go on disability. And others that are just looking for a reason because they become very expensive. So it can be very tricky, but if you're in a comprehensive cancer center, please ask to speak to your social worker, your financial advisor, or seek legal help like today.
And one more thing that I forgot about that. If you are able to work, but you just simply cannot do the exact same thing that you were doing before, if you're doing a job that requires you to stand up for 12 hours a day, and you think you can still continue to do that job with just a couple of breaks where you get to sit down, again, that's something that we can help you with too. It's called a reasonable accommodation. You are protected under the law for asking for something like that. We do those quite a bit. So just please don't hesitate to give us a call. We'd be happy to walk through your options with you.
This somewhat mirrors the previous comments, but our care team that we have on a hospice team, again, is a pastor, a social worker, an aide, a nurse, and a volunteer coordinator. And then we will include, as required, physical therapy, occupational therapy, massage therapy, things like that, sometimes, not automatically. But our social worker is there to support people through these processes. And I don't even pretend to understand all the acronyms or everything that these people do, but here's what I can tell you. It's what they do every day for a living. So for you and I to try to do it, we're like, wow, this is a lot of acronyms. This is really confusing. It looks like 100 pages of forms. I don't even know where to get the form. I certainly don't know where to fill it out. And I don't know what to do with it after I'm done. these people do this every day, and they have the personal cell phone number of the person they're faxing it to, and that's very, very helpful. So my advice would be, whatever it is, get with someone who this is what they do every day, and their heart is in it. They're going to help you get where you need to be. Thank you.
Any questions from the audience? Okay, think of them. I'm going to keep rolling with the ones that had been provided before. I had a mastectomy and lymph nodes removed when I was first diagnosed 4 years ago. Now I'm stage 4. I'm getting chemo and having swelling in my arm. Is it too late for physical therapy to help me?
It's never too late. So what I would say is the sooner that we see you, the better. In this case, I would say get into a PT clinic or an OT clinic or with a certified lymphedema therapist very quickly. Not only are there issues, post-surgical issues, post-mastectomy, post-reconstruction, post-radiation, post-chemo, during all those different treatments, but there's swelling that can occur as well. And what Katie was asking about, or what this person was asking about, is swelling in the upper extremity, maybe potentially on the upper quadrant, the anterior quadrant, the posterior quadrant. These are all things that a therapist can absolutely help you with. And not only will we treat you, not only will a lymphedema therapist or a PT or an OT treat you, but what they'll do is they'll explain what's going on to you. So they'll educate you. They'll educate you on your risk. They'll educate you exactly as to what's going on. So there's a much greater understanding as to what's happening in your body. And then we'll treat it. And then once again, we'll bring you back and we'll keep you coming so that there's a surveillance as well as you're going through the rest of your treatment or the rest of your life. And so as we educate you on how to help yourselves, whether it's with compression of the arm, compression of the breast area, compression of the entire upper quadrant, or it's exercise. Exercise has been proven to help individuals who have lymphedema, that swelling that I'm talking about. Resistive exercise has actually been proven to help quite a bit. So what I'm talking about is gentle strength training. If you have areas of bony metastasis or the cancer has spread to other areas, those are things that will be addressed by your therapist at the time, so that we're giving you exercises that are appropriate for you at that specific time and where your body is. So you'll understand what your risk is, what your restrictions are, what you're able to do. And then going forward, we modify that as treatment continues. As years go on and on, we'll definitely modify it.
I don't make any money from any physical therapy, anything, but I want to say this as someone who is not financially interested in that. A lot of hospices don't allow inclusion of physical therapy because it's considered an aggressive form of treatment. We do. And this isn't a plug for my company either, but I can tell you that every single time it has been of fantastic benefit to the patient. So across the board, whether this is someone who's going to graduate off hospice and go back and live their life, or whether it's someone nearing the end of their journey, I've never seen it do anything other than help that patient be more comfortable and enjoy the quality of their life. I highly endorse it.
And in addition to getting to Turning Point, and we love Turning Point, yay, Turning Point, for the pain associated with lymphedema, also making sure that you're taking care of that as well and monitoring your skin. So, but if it is possible to get to a lymphedema specialist, at least in the beginning, that's really important. And like she said, it's never too late to start, even with patients with very advanced disease, because it can be so uncomfortable. But if it does become uncomfortable, it can definitely be managed, but it's a lot easier with the help of a trained therapist. So we're really lucky to have Turning Point.
So a couple of things that came up. I think education is power. I think the more that we know from somebody who has read the research and understands what's out there in terms of treatment, Dr. Google scares quite a few of our patients. And there's a lot written about lymphedema on the internet that will throw people over the edge. And what I will tell you is if you come to a certified lymphedema therapist, they will explain to you your risk. They'll educate you about what lymphedema actually is. They'll treat you appropriately. So they'll guide you through your treatment, which is really which is a wonderful thing, but it's also wonderful because you all educate us as well. We learn every day by listening to all of you. And the more communication there is and the more research that's out there, the better we are to treat you all. The other thing is that what he was talking about is that it is not an aggressive form of therapy. When people think of physical therapy, they think about pushing and shoving joints to their end range and maybe manipulations. That's not the type of therapy that we provide. We provide therapy that's appropriate for you based on where you are in terms of your treatment and your illness and the drugs that you're taking. We understand a lot of these medicines cause a lot of joint pain. We treat that joint pain. We educate you about it. We educate you how to help yourselves as well as us working on your soft tissue mobility. We do manual lymph drainage, which is a very gentle type of massage that moves the lymphatic fluid away from the area that's compromised. So it's a very gentle form of therapy. So please don't be afraid to go see a physical therapist or an occupational therapist. They're not there to hurt you. The no pain, no gain rule does not have any place in our clinical treatment at all.
Sorry, piggybacking on that comment just for 1 second, and only tangentially related to physical therapy, but on Dr. Google, like lawyer Google is also not great. Don't, if you have a question about Social Security, you can go down a rabbit hole very, very quickly about common mistakes and errors. God forbid it's something to do with the housing eviction. Just call someone whose job is to read the fine print and look at all of the loopholes and understand all of the rules and regulations. We're here to do it for free, and if we can't help you, we'll find someone who will. But just please don't trust Google as the answer to your problem. So many people get in trouble by doing that. And if you wait too late, there's not much that we can do. So just call us at the beginning, and we can try to help you sort it out.
As experts in your fields who have amazing training, both schooling but also on-the-job training, and you see so many people in this position, and you're also wonderful people, what do you think they're too shy to ask you? What should they know?
I do think that there's a question that you probably are thinking, because it's the question I would be thinking if I were you. I'd be like, so we got a bunch of people in this room that are here fighting cancer, and we're 100% convinced we're going to beat it. That is our intention, and we're joining together to do that. And you're a hospice guy. How dare you come and talk to us? Why would you do something like that? That's what I'd be thinking. Maybe you're not. That's what I'd be thinking. So I want to answer that question. I just want to tell you, hospice is about keeping people as comfortable as humanly possible. Hospice, we are not even legally allowed to just knock on someone's door and go, hey, I heard someone in here has cancer. Wanted to talk to you about that. Okay? We're not even an option for you unless the person, your oncology team, if they make a decision, we have tried everything we know how to try. We are out of options. At that point, they will issue a referral to you and your family so that you can discuss if you even want to talk to us. Why would you? Why would you want to do that? Well, if your oncology team has decided we can keep doing stuff, it's not working. You can keep getting chemo and radiation, it's not working. You may or may not make a decision, then I don't think I want to do that anymore. I think I would rather go on a picnic with my children every day and make movies and read to them. I think that next time my medicine isn't working right, I don't want to make an appointment and come in the next day. I want you to come to me at 2 a.m. I would like to have an aide come see me 5 times a week for an hour each time and help to bathe me or help me with my, what we call activities of daily living, but anything that you need help with around your house. I would like a pastor to come and talk to me and my children and my husband and my mom and help them to understand what's happening here so that they have some peace. I'd like a social worker to come and help me. And I don't want to make appointments. I don't want to go send someone in my home to a pharmacy to wait. I want you to bring the medication to me. We'll do that. And we'll do it as long as we're your best option. And like I said, the second we're not, fire us. I want you to be too healthy to be on hospice. But if you're not, and if it is an appropriate thing, our job is to spend 24 hours a day being available to you and making sure that you're enjoying your life to the very, very best of your ability to do so. So that would be the question that I think that no one would ask me, but that I would want to know if I was you. Does anyone have a follow-up question about that before I pass the mic? Because you're allowed. All right.
So I would say one of the questions that I get asked most is, well, what can I do? My joints hurt. I'm taking this medicine. I'm tired. I just don't know. I have some bony metastasis in my hip. Where do I begin? I want to exercise, or I was exercising before my treatment and I haven't exercised in 9 months and I'm just dying to get back to it. Where do I begin? So that's where we come in. We assess you, so we evaluate you. We make sure that we've got doctor approval in order to treat you at this point. We bring you into the clinic. We evaluate you. We sit down. We have a nice long conversation. I get all your medical records from your doctor, so I know exactly where the issues are or what's happened or what the scans say. And then we have a conversation. And it's really at that point, it's about what your goals are. It's not about what my goals are for you. It's about what your goals are. You want to get back to Pilates. That's your happy place. Someone told you you can't ever do Pilates again because you've got lymphedema and you've got something going on in your back. So we talk about it, and then we put you on an exercise protocol. We look at your range of motion. We look at the range of motion in your shoulders, in your neck, in your back. We see where your limitations are. We discuss pain, as somebody else mentioned on the panel. We talk about your pain. If there's pain, we deal with it. We work around it. We strengthen the areas that need to be strengthened. We stretch the areas that need to be stretched. And we get you back to doing what you love best, because my goal is what your goal is. And if you don't ask for help, or if somebody doesn't come to me and say, Lauren, I want to play tennis, but I can only lift my arm to here, well, then I don't know what the goal is. But if the goal is to play tennis, we will do our best to get your range of motion back based on what's going on in your body. We'll talk to you about the medicines that you're on that are potentially causing issues in your joints, whether it's pain, whether it's stiffness. We'll talk to you about your fatigue. Exercise has been proven to help a lot of these different things. And so what we may need to do is we may need to modify that exercise. Unless somebody's educated you on how to modify exercise and you walk into an exercise class, you can injure yourself. So we'll talk to you about modifications. So what we do with these questions is we kind of put them back on the patient, and we say, well, what do you want to do? What's your goal? What can we do to help you go back and have a wonderful quality of life and do the activities of daily living and spend the time with your family that you want to spend doing all these wonderful things, and we'll help you get back there. So it's about someone looking at you as a whole and not just a part, and figuring out functionally what you need best in order to get back your mobility, decrease your fatigue, decrease your pain as best as we can, and then get you back to doing all the things that you love to do.
Get back your mojo.
Get back your mojo, exactly.
Any suggestions?
Did you have a response? May I? There's a couple different ways that we can look at this. So the first thing and I'm dealing with this from a hospice medical perspective, right? But the first thing we need to understand is, especially something as complicated as depression, is that a medical issue or an emotional issue or a chemical issue or a neurological issue? Yes. All right, so the first thing I would ask is, okay, this medication that is causing you, it's lowering the quality of your life. What are you getting for that? Is the trade worth it? Because on television, when we do medical stuff, it's just good. There's not a downside. That's not my understanding. Everything's a trade-off. So, whatever this treatment regimen is it worth it to you to continue doing it? It is worth it to you. And then, so let's say we're talking about depression. A couple ways to go there. What I would be thinking about is, all right, so there are maybe ways that we could take a look at this person's diet, understood, but there also, is this a chemical imbalance in this person's brain? Because I got to tell you, if you have metastatic cancer or you're dealing with a terminal disease and you're not depressed, you're insane. Okay, so here's the thing. So we put you on a mood stabilizer, just like a whole bunch of people in America are on. It takes 30 days to take effect to build up in your blood. And in about 20, 30% of the cases, it might make your symptoms worse. So are we going to try that? Yeah, we need to very closely monitor that. So there are other medications that we give people for anxiety and agitation. They work immediately. They don't have to build up in your blood for 30 days. So I would be thinking, I need an immediate solution. Then I would be notifying my chaplain and my social worker, as well as asking you as your nurse, what do you want to do? Open-ended question. What would make you happy? Maybe it's not even something medical. Maybe it's not even something I can help you with. What do I want to do? I want to go skydiving. Well, my advice, go skydiving, right? But as far as medically, we need to take a look at, should we continue this treatment? And then if you're having a symptom of depression or anxiety or agitation or any other symptom, we need to effectively manage that. The difference between us and a regular medical team, and God bless them, is they're not going to come to your house at 2 in the morning and wake up the doctor at 3:15 in the morning for new orders. We are. And we're going to send someone every day to see you and you're the judge. I'm not here to go, well, sorry, too bad, that's it. Sorry it didn't work good enough for you. We keep going and adjusting until you go, all right, I'm good. So that's our promise to you, to do our best. But again, my advice is we need to take a look at the reason for the anxiety and the depression, because if you're not having anxiety and depression, you're nuts. So you are allowed to feel that way. I'm going to give it up. I know. Thank you.
And some of the treatment, when we think of, I had one lady come into me and she said, well, good grief, Kim. I was supposed to have cancer. The one good thing was I was supposed to have weight loss. And it's one of those symptoms that we don't often explain or explain very well. So when my patients come to me and that's the primary problem, we first talk about, okay, there's going to be a certain amount of weight gain with the medication. So what's the excess weight gain? Because what happens is you're already tired, you're not participating in physical activity. So now I'm just going to say, okay, now you're tired, you've gained weight, and what do I want you to do as your palliative care doctor is get moving. And the reason why, for a couple of different reasons. The more you are physically active, you may not lose some of the weight that the primary treatment is causing, but you will be stronger, be fitter, and your clothes will fit differently. So the idea of thinking of weight on the scale has to go out the window, and now we're thinking about the way we put on clothes. We're also going down to, and many of your cancer centers will have, people that will come down and they'll do wigs or makeup, but trying to figure out what physically about yourself to make you feel more like you again. So being healthy and eating right and exercising is a lot more than just something that they're asking you to do. It actually helps combat the cancer-related fatigue. It helps keep your body, even if it's heavier, in better shape. Does that make sense? Yeah, because what I see is the weight that's gained by the treatment, and then, as you so aptly meant, then I can't believe this happened. This adds insult to injury. I move less, and then depression comes. I start feeling badly about myself, and then I can personally attest to this. The parachute pants come out, and so does the scrunchie. So the ability to still feel beautiful, finding ways to do that, those things that were important to you, like getting your hair and your nails done, sounds crazy, but we do encourage our patients to do that. We encourage our male patients to do some of the things that made them feel the way they were before. And then a lot of work on how do I get to love this new body? How do I get to love these new curves? So that's a huge thing, trying to learn how to accept, this is the way I looked now. I had this treatment and it's great. The cost of this wonderful treatment was this. Can I get to learn to love this new body and this new look? Does that make sense? Yeah, figuring out a way to still feel beautiful.
So, and then let's take it a step further, the physical perspective of it, which is where I come in. So what I would say when a woman walks into my office and she's gained weight, which quite a few of them have, like she said, they think they're going to lose weight and they gain weight. We do discuss exercise, like we were talking about. It definitely helps with fatigue. It does help with some of the anxiety. that comes with the weight gain. We definitely talk about the psychosocial part, so talking to somebody about the weight gain or the changes in your body in general from head to toe. You've had surgery now, your chest doesn't look the same. You've had radiation, that doesn't look the same either. It doesn't feel the same. I don't feel the same anymore. You just feel different. So we start addressing those from a psychosocial perspective. But in terms of exercise, if you want to get back into exercise and you've gained weight and you don't feel so comfortable about yourself, I know people don't like to get in bathing suits, but I will tell you aquatic therapy is quite helpful. It's very calming. It feels good. You talk about getting in the water. I promise you look just like everybody else there and nobody cares about the way you look. Aquatic therapy is a good place to start, especially if you have the joint pain and the weight gain and the fatigue. It's slow moving at first, and you can make it as high energy or as low energy, or you can give it as much as you've got that day. And I think aquatic therapy is a great place to start if you've had some weight gain and you just don't know where to begin. Yoga is another wonderful place to start. Maybe some restorative yoga, sitting in a chair, working on your breathing, just finding your center, finding some inner peace, and then moving on from there. There's a nutrition component to this as well. So when women go through treatment, many times food doesn't taste good anymore. Their taste buds have changed. So you may be eating food that's not quite healthy for you. Even though you're trying to be healthy, you don't know exactly what to eat or how to eat. So maybe addressing the nutrition component as well, because if you can't change what you're putting in your body in terms of the medicine, let's work on the areas around it that you do have, that you can change, and that you do have the ability to have, to make a goal for yourself and then move forward.
We have an awful lot of,
No, I was just going to say, the weight on the scale may not change with exercise, but everything that's down here will start to come back up. And that's the only really important thing. Not all the way, but it inches back up. We're just trying to keep it up.
well, as we wrap things up here, we are lucky to have a lot of amazing caregivers with us. What advice would you give to them? Because we know that our caregivers need to take care of themselves as well.
Well, those who just spend an hour with me in our seizure-provoking lecture, most important thing for our caregivers is please communicate your needs and be kind to yourself. Because it's not going to be perfect every day, but you're doing an incredible job. But if you are not taking care of yourself, the very thing that you are afraid that will happen, that somebody won't be there for your loved one, will happen if something happens to you. The other thing I would often to remember is that it's okay to say, what about me? It's okay to feel that way. And so definitely okay to have the emotions that you're having. And finding help for yourself, finding an outlet is incredibly, incredibly, incredibly important.
I think mine would just be along those lines of just have some grace for yourself as a caregiver. Make sure you have a support system of people to rely on and people to talk to. I can't remember who said it, but there's the circle of support, and the person who's diagnosed is in the middle. You can't go in, but you can go out for support. So if you don't want to rely on your partner to bear the burden of the feelings that you have, make sure that you have a very good support system of your own so that you can discuss things with. And there are so many people here who are willing to help in any way that they can. That's why we show up to these conferences, so that we can get the word out and let you know who to reach out to. But yeah, just have some grace with yourself.
All right, settle in, because I'm passionate about this question. So we're going to talk. If you're a caregiver, I want you to consider some things that I've seen firsthand from doing what I do for a long time. I want you to rest. I want you to eat. I want you to go outside and get some sunlight on you. There's a medical component I'm going to talk about. I try to stay away from the big medical words, but this part of the conversation is when your grandma told you that you need to go run around outside for an hour every day, here's why. So serotonin inside your body is what makes you feel great, kind of that Thanksgiving feeling of, yeah, it's a good day, all right? It's only activated by active vitamin D. Vitamin D is only activated by direct sunlight. This is why when you're really, really bummed out about anything because your boyfriend broke up with you or whatever, and you just keep staying inside and you're more bummed out, really don't want to go outside now, whatever. You don't have to be outside for an hour or two, 5, 10 minutes. We'll make a difference, okay? So get outside, get some fresh air. Please consider if the person you're caring for, and it looks like no one in this room is in this situation, but let's say that they're 98 years old and I would have to put them in a wheelchair. Awesome, put them in a wheelchair. Go for a walk, all right? Change of pace. Please do that. Number 2, as Americans, when we face crisis, people say, I am so sorry. Is there anything I can do to help? We automatically respond, no, but thank you so much. Stop saying that. When they say, is there anything I can do to help? You go, yeah, absolutely. Does your son still mow yards? Could he come mow the yard for me? You know that lasagna you make? Could you make me a covered dish? Thank you. They're asking because they want to feel good, like they're a good person, that they're helping you through a crisis. If they're there asking you the question, it means they love you. Let them. Okay, dovetailing on that, and I've been in these shoes myself. So you're caring for someone who's really sick. So you look in the mirror and you know what you decide? You're not allowed to be happy. How dare you be happy? How dare you rest and eat when this person can't? You're on a vigil. You're on guard duty. If they can't be happy, you can't be happy. I want to talk to you about that. You know what's going to break their heart? The patient. It's not going to break their heart, everything that's happening. It's going to break their heart when they look up into your eyes and they know in their heart that you resent them in this situation. Don't let that happen. Give whatever you can give with a joyful heart. And when you're getting out of that zone, you got to step outside. You got to get some air. You need to take care of yourself. The quality of the time is more important than the quantity of the time. That's for everybody. I might get run over by an ice cream truck in 23 minutes. That's not up to me. I don't know when I'm going to heaven. Just trying to have a good life. Just trying to love the people that God put in my path. Please consider that. Please take care of yourself. And lastly, all I would say is, if you being miserable would make the person better, I would come hit you in the head with a baseball bat myself. But it won't. And they don't want you to be miserable. They love you. Thank you.
Well, I don't want to go after that. So this is so all of this is wonderful advice. And all I would say is there's power in touch. And there, as women or as people get sick, everyone's afraid to touch them. And that's so important. Touch is okay. And if you're unsure how to touch somebody, and I'm not talking about touching their soul, I'm just talking about putting their hand on their arm or rubbing their arm or rubbing their head or rubbing their feet. If my mom liked to have her feet scratched when she was sick, I don't know. It made her happy. So this is what I'll tell you. Touching your loved one and the person you're caring for is so important. And if you're afraid you're going to hurt them, talk to them. Or if you're unsure, come talk to us and we'll teach you how to touch. But I think that that's so important because it gets lost as people get sick. Sometimes the power of touch gets lost. Post-surgical, the power of touch gets lost. We forget how to touch each other. And I think it's really important that if you're unsure, if you're scared, you're not going to hurt them. They'll talk to you, but if not, come with us and we'll teach you how to touch. And come to the clinic together, that we do this all the time, and we teach you how to help your loved one. So thank you.
So as we wrap things up, I want to thank so much all of our panelists for being with us today. You've imparted such knowledge, some tough love that we needed to hear. Thank you very much.
We'll be hanging out, so if you have an individual question for any one of us, just come see us. Whatever it is, we'll sit down and talk about it. God bless you. Thank you.
Thank you. And you're welcome to stay, and we're just going to close things out here. What an amazing day. And I don't know about y'all, but so many times today, I just teared up. It's been a beautiful experience. Again, a labor of love, and I want to thank everyone who helped make this day possible. I want to thank each and every one of you for being here with us to learn, to connect, and to grow together. Please remember to fill your surveys out. If you didn't get a hard copy survey, we have them out front. We'll also send it out to you via email for those of you who would rather type it in than write it in. And your parking validation, one last time, there's still parking validations available in case you didn't get yours. And then finally, a thank you. I want to thank the amazing Komen staff who put this together along with our fabulous advisory committee. advisory committee who worked really hard with us too, our community partners who were all outside to provide additional information for you, and our wonderful sponsors, including Northside Hospital Cancer Institute, Eli Lilly and Company, Amgen, and Genentech, and all of the other sponsors. Thank you, thank you, thank you. Please be safe on your way home. We cannot wait to see you again. Thank you for spending your day with us.